Now, let me bring us to some of the critical issues in Zimbabwe, what has been happening around drugs, and what is our current situation. So we have, in 2000, there was set up the first draft of what we call the National Drug Control Master Plan. So the master plan constitutes a framework for addressing issues to do with the drug and alcohol abuse, where we have mechanisms and interventions that look at the supply, reduction, prevention, and the rehabilitation, pillars. So that was the first draft was, put together in 2000. But for several reasons, we only managed to have the final draft actually being implemented and formally promulgated as a policy in 2019. And at the same time, we also promulgated the National Alcohol Rehabilitation Guidelines. So it's an international best practice that every country has to have a plan that feeds into their policy framework to address the issue of drugs at a national level. So at the moment, the implementation of the National Drug Control Master Plan has been put under what we call an interministerial task force on drugs. This was set up by His Excellency, our President, Idi Mnangagwa, where the chairperson of that is the Minister of Public Service, Labor and Social Welfare. So this is the ministry that is an overarching, administrative role in terms of steering the interministerial task force on drugs. But various ministries, such as Minister of Health and Childcare, Minister of Home Affairs and Cultural Heritage, they've got various pillars that they are responsible for under the National Drug Control Master Plan. So in terms of our time, I will not go into too much detail, but you need to be aware of these documents, even to take your time to just read as a country, what are we doing with the issue of drugs? So that's one of the things that we've put. So why do we need such a master plan when we have acts that try to control how drugs are moved, how drugs are used, how drugs sold even at a pharmaceutical level? We need that to be coordinated, and that coordination and harmony is brought about through the National Drug Control Master Plan that is chaired by the Ministry of Public Service, Labor and Social Welfare. Now, I alluded before to the World Drug Report 2021, which provides an in-depth analysis of the global drug markets, and it also paints a comprehensive picture of the measurable effects and potential impact of the COVID-19 crisis on the world drug problem. So when you even look at Zimbabwe, our drug issues also were exacerbated by the COVID-19 pandemic because of the stress levels that came with it. The issue to do with coping also led a lot of our people, especially the youth, into using drugs, particularly because it disturbed the ability or their school attendance. And when you have people being idle, there's that tendency then to have that exploration into a lot of other issues that are not very, very productive. And so if you look at the World Drug Report of 2021, it goes to length to talk about that. And we have, when I share the presentation, you also see some of the drug hotspots in the country, in Zimbabwe. And if you take a close look, you realize that a lot of these are around where we have a lot of youths involved in various economic activities. For those, for example, we have a lot of artisanal miners and things like that. And also those youths that are that are in and out of school, they've also become a target for the drug market. And we needed to be aware of that.